I'm John Bruning, CEO of the Australasian College of Paramedicine. The college is the peak professional body for paramedics across Australia and New Zealand, representing the profession for over 50 years. The past 12 months has been an exciting time for both paramedicine and health, looking at the scope of practice review and the work the federal government is doing in progressing multidisciplinary team care and improving patient outcomes for our communities. Paramedics have often been seen just as an emergency response, working with their state-based ambulance services. The scope of practice review has shown the opportunity for paramedics to play a key role in supporting the healthcare of our communities. While most of our communities see paramedics related to emergency response and ambulances, they have for some time been providing care to the community that is more in that primary care space. So it's a natural progression that paramedics are utilised more widely in primary and urgent care for our communities to improve the health outcomes.
I'm Michelle Murphy. I'm the Advocacy and Government Relations Lead for the Australasian College of Paramedicine. I'm an intensive care paramedic. I'm an adjunct associate professor with the University of Sunshine Coast in the School of Health and currently working as the National Manager for Integrated Care Pathways and Partnerships with 4Health. Part of the challenge with access to healthcare is having a sustainable health workforce. Paramedicine is currently the fastest growing health workforce, growing at 9% per annum for the last 4 years. And compared, if you look at the Australian Institute of Health Workforce data and you compare that to general practitioners and nurses who are growing at 1 to 2%, having a sustainable paramedic workforce or having a sustainable workforce that's going to grow with the needs to meet the demands of the community is critical. I think there's a really great opportunity right now in the history of paramedicine to really be part of the reform occurring across the health landscape. We know that access to primary care is at its all-time lowest, with data suggesting that 39% of patients are waiting more than 24 hours to get urgent care. We know that our ambulance services and our emergency departments are overwhelmed with lower acuity, what we would call category 4 and 5 type patients. Some great work that came out of New Zealand by Associate Professor John Addy in 2017 identified that up to about 35% of patients attending emergency departments with these non-life-threatening minor injuries and illnesses could adequately be treated in primary care.
So a study was done by Deloitte in 2019 looking at the workforce of general practitioners from 2019 to 2023. And what the study found was that there was a 38% increase in unmet need predicted, but a 25% decrease in the medical workforce over that time. To me as a medical practitioner, this is quite scary, because who's going to run our general practices and who's going to run our urgent care clinics? So when we look internationally at what other countries are doing, they are adopting models which include nurse practitioners and community paramedics as a workforce. And I'm really excited about those practitioners joining GPs on the floor, seeing patients that present with non-life-threatening urgent conditions.
Urgent care clinics are a new model of care introduced in the past couple of years, seeing non-life-threatening injury and illness treated outside of the emergency department. Paramedics, unfortunately, were left out of this opportunity when it was initially proposed, and we're calling for paramedics to be used in this space. Paramedics are really the experts in urgent, acute, unplanned, unscheduled care. That's what they do day in, day out in the ambulance service, and they should be utilised in these clinics to improve patient outcomes, working part of multidisciplinary teams with doctors and nurses to improve the outcomes for our communities.
Nearly 8.8 million patients present to an emergency department every year. Reviewing the data, we know that a large proportion of those patients are lower acuity or could have their condition treated in a primary care setting. Approximately 10 to 30% of adult patients and 41 to 51% of children could be safely managed with their presentation in a primary care setting. Urgent care clinics are, filling that gap in the current healthcare system between family or primary care and tertiary or hospital-based care. We've seen the federal government commit to 58 of those. We've seen the states also commit, somewhere between 5 and 25, depending on which state. So it's a real shift in that model and that system of care within the Australian healthcare landscape. I think it's actually providing patients and the communities with somewhere to go when they have urgent or, unplanned, events occur that they need some medical help for. And it's actually reducing the pressure in our emergency departments and ambulances. Paramedics are well placed to be able to work in these urgent care clinics to deliver that ad hoc, unplanned clinical care when it's not an emergency, but it's urgent. Paramedics have the capabilities and the skill set to be able to work in these urgent care clinics, and they also have the workforce and the volume of growth of workforce to well placed to be able to work in some of these centres. Multidisciplinary teams improve access to care because they actually enable communities to think about the health providers that they need, think about the care that they need access to, and then they can bring about those different providers of healthcare to work together to be able to deliver care in communities. So rather than relying on one person or one doctor or one nurse to deliver all the care, when you make it a team sport and you have a whole group of people participating together to deliver that care, not only do you improve accessibility to care, but you improve that professional collaboration, you improve that multidisciplinary and that interdisciplinary relationships, which keeps people in the workplace longer, makes the health professionals happier, and provides that access to people in their communities.